So let's take a couple minutes to talk about how to plan for your surgery to avoid any unnecessary aggravation, cancellations, and have a seamless process. So once you meet with your surgeon and you figure out exactly what type of surgery you're having, the first question you want to ask is, what is the downtime after this type of operation? If you are working, do you need to take time off from work? If so, how much? You also want to understand, do you need to see your primary care doctor before surgery for any type of clearance? Most likely, if you have a heart problem or a lung problem, for example, you might need to see your cardiologist or your pulmonologist before surgery to make sure that everything is teed up in advance. Another thing that's important is to understand, do you need blood work before surgery? Certainly in larger surgeries, you most likely do. And so you want to understand how far in advance to get that done. And then the other thing that's really critical is understanding when you need to stop eating and drinking before surgery. So it's different at different hospitals, different surgery centers. Also, there's certain types of medications that need to be stopped in advance. So you really want to understand all of that and ask those questions beforehand, so that way you don't have any problems moving forward. Specifically, if you are taking a GLP-1 medication, there is a certain protocol that you'll need to follow in terms of stopping the medication and diet before surgery. So these are just a couple things to keep note of, make sure you follow through, because surgery is very stressful, and the last thing you want is to have a cancellation or an issue that could have easily been avoided. Okay? Hope this was helpful.